Hi, this is Tanita with No Hair Shame. Listen, I want to say thank you for, coming back to the channel. I want to let you know that if you would hit that subscribe button, if you are watching on YouTube, you will get a notification when I do other teachings and they're uploaded, okay? And so what we're going to talk about in this particular video is a type of hair loss that can happen as a result of a type of illness. For some people, it's a chronic illness, meaning it can last beyond a year. And so I want to make sure that those that are dealing with this type of illness or these types of symptoms, that they are aware and that they're able to monitor this type of hair loss. Okay. And so we're going to go ahead and get into this and start talking about this. Okay. And so what is important is so that we are aware that this type of illness, if you are diagnosed with this, can cause some hair loss. So we are going to discuss diabetes and how plays a role in hair loss. Okay. And so I'm going to go through the studies. This isn't anything new, especially for those that may be dealing with diabetes. I'm sure that you're pretty knowledgeable of what is going on because you probably are experiencing it and you're probably doing a lot of things that I'm talking about. Of course, I'm not a medical doctor. Let me start with that. However, this is information that is not hidden, it is out there. And I'm going to go over it for the purpose of talking about what it is for those that may not be aware, and then talking about how it plays a role in causing hair loss. Okay. So, diabetes is a condition, okay, that happens when a person blood sugar, which we call glucose, is too high. All right. So, we're going to talk about that just briefly. And basically, glucose is in your bloodstream, and glucose needs the assistance in order to reach its final destination in your body. Okay. And the assistance that it receives is a hormone that is called insulin. Okay. Now, insulin is produced by the pancreas. And if for some reason the pancreas isn't making enough insulin or your body isn't using the insulin that the pancreas does make properly, glucose will build up in your bloodstream. And as a result of that, a person will experience what they call hyperglycemia, which is high blood sugar. All right. And so I'm going to go over that one time. Diabetes basically is a condition when glucose, which is blood sugar, is too high. And glucose is in your bloodstream. However, it needs the assistance of the hormone that is called insulin um, in order to reach certain destinations or get to certain parts of the body. Okay. So the pancreas makes this hormone that is called insulin. And if for some reason the pancreas isn't making enough of this insulin, or if your body, a person's body that is dealing with diabetes, is not using it properly. So this insulin that the pancreas makes, if it's not making enough, or if it's not using it properly, the glucose, yes, will build up in the bloodstream. And as a result, you're dealing with high blood sugar, which is called hyperglycemia. Okay. And so glucose, um, which is blood sugar, I just mentioned, mainly comes from the carbohydrates that are in the foods and drinks that we eat. So if your body is your body's main source of energy, is the main source that it goes to for energy, okay, these carbohydrates. So your blood carries glucose to all parts of your body's cells in order for you to be able to use that energy. Okay, so if for some reason, um, when your pancreas develop or it doesn't make enough insulin, or not any at all. So if a person's pancreas does not make enough insulin, or it doesn't produce any insulin or make any insulin at all, or when your body isn't responding to the effects of insulin, that's when a person is usually experiencing what we call is diabetes. Okay, so diabetes affects people of all ages. So it's not a certain age group, it can be in different ages. And then most forms of diabetes can be chronic, lifelong. It doesn't have to be, but it can be. And all forms, from the study that I saw, are manageable or can be managed with medication and lifestyle changes. So some people may decide, hey, I'm going to change my lifestyle. Some people would choose medications, or some people do both. Okay. So that's basically a overview of what diabetes is. Okay. So too much glucose circulating in your bloodstream causes diabetes. That's pretty much what it is. Too much glucose circulating in your bloodstream, regardless of what type it is. Reasons why your glucose levels are high differs depending on the type of diabetes. Okay. So today we're going to talk about insulin resistance, which from my understanding is type 2 diabetes, and it mainly results from insulin resistance, and it happens when your cells in your muscles and the fat in your liver does not respond as it should to the insulin. Now, from what could see, several factors and conditions contribute to varying degrees of insulin resistance. Um, and one of the things that I saw was obesity, and then the lack of physical activity, as well as a person's diet, and some people it's genetics and certain medications. Others, it would also be hormonal imbalances. So these are some of the factors or conditions that contribute to it. I'm going to go over that one more time. It could be, to varying degrees, it could cause insulin resistance, obesity, lack of physical activity, um, diet, of course, that would be what we eat, genetics, hormonal imbalances, as well as certain medications. Those are some factors that can contribute to a person dealing with type 2 diabetes. Okay, so like I told you before, some people will make a decision that they're going to use medications, or their doctor would prescribe them medications or put them on medications. Others can do lifestyle changes, and some people have done both. But in order to manage it, you could manage it with a diet, which means that you would probably need to do some meal planning by choosing a healthy diet. Um, that's a key aspect of diabetes management. And food, because food greatly impacts your blood sugar. Okay, so that's why you want to make that choice. I would say, even if you had medication, um, you still want to make sure that you manage this. I even said it to people that are not dealing with diabetes, because I believe, well, I know that having healthy hair, you're going to have to make sure that you choose healthy meals. Okay. Also, if you take insulin, you probably want to count your carbs in your food and drinks that you consume, as a large part of the management. Okay. So basically, the amount of carbs that you eat also can determine how much insulin you need at your meals, and your doctor go with that. So I'm not a doctor. I'm going to leave that alone. Also, healthy eating habits can also help you manage your weight and reduce your chance of heart disease risk. Okay. All right. Another thing that you can do to manage diabetes is physical activity, making sure that you have a, I guess you could say, a routine of exercising. Um, it helps you reduce insulin resistance. So regular exercise is an important part of management of all people with diabetes. Yep, and your doctor will probably tell you that. Okay, so that is all a part of this, and the reason I went over that is because if a person is dealing with diabetes, it could or it will affect their hair, because what we're talking about is blood sugar, as I told you, being too high in your bloodstream. Okay. And so let me tell you what I probably haven't said, or I said in other videos. Hair is a non essential organ. And what that means is that you don't have to have hair to live. However, the other things that we were talking about, like I mentioned to you about your liver, is quite important, right? And there's other things that are important, other organs, if people are dealing with different types of conditions or any form of diseases or anything like that. There are things that are essential, but hair is not an essential organ. And the reason I'm saying that is because if you have anything else that is going on and happening in your body is going to make sure that other areas that are essential receive what is needed, right? It's going to make sure that those parts of your body will receive what is needed. and the hair won't receive it. And so what we have to do is address whatever issues are going on in our bodies and making sure that those parts of our bodies receive what is needed, okay? And it gets the right amount what is needed so that it doesn't have to take from other areas like our cells that produce hair. Okay, because if you have a deficiency or some things that happen in other parts of your body, the cells that produce hair are going to go without because it's not essential, right? But if you take care of other parts of your body, the systems and the organs and things that are essential, if they get what they're needed, if they get what is needed, then the hope is that you have a balanced body. And so those cells, those organs get what is needed. And then the hair can also get what it needs in order to produce healthy hair. Okay, so that's why this is important. Okay, so what we're going to talk about, diabetes often goes hand in hand with autoimmune issues. And so as a result of that, bacterial and fungal infections can form on the scalp due to diabetes. Okay, and this can result in a hair loss. So get what I'm saying. Because diabetes is an or it creates autoimmune issues, bacterial and fungal infections can form on the scalp. Okay, so unfortunately, this type of diabetes is often accompanied by immune issues, and so when we're dealing with immune issues, um, we can deal with the type of hair loss that is called alopecia areata. Okay, and an autoimmune condition that causes hair loss in round patches. Okay, so alopecia areata shows itself or presents itself round patches. And sometimes what'll happen is you will discover that you have a patch, and then what'll happen is hopefully that patch will grow back. But it's usually kind of circular. It's very smooth, just as smooth as my hand or your inside of your hand. Is usually about the size of a large coin. Okay, and it'll be very smooth. And we want to make sure that we are monitoring this because if we don't take care of it, let's say that we don't do the things that I mentioned to you about managing this type of diabetes, that means that this autoimmune condition could progress. And with bacterial and fungal infections being on the scalp, it could move from being alopecia areata to scarring alopecia. And scarring alopecia is going to move to a situation where that hair is not going to grow back. And so we don't want to get over into that. Also, stress is directly related to diabetes. And this is because this type of disease, from what I've seen, can cause excessive anxiety in a person. Okay. And stress, it can definitely have an effect on your hair. So you want to think about that. Now, there are some situations when you have this type of hair loss where people, um, let's see, have gone and they've gotten or they have received injections of corticosteroids, corticosteroids, okay? And so that's not something that I'm saying that everyone needs, because if you were to manage it and you get your diabetes, if you get that regulated, working with your doctor and everything, you probably could reduce the bacteria and fungal infections that occur on the scalp. And you probably would be able to avoid um, possibly having to do that. Okay. So to reduce autoimmune responses, you may have to lower your exposure to pollutants. You're going to have to eat a healthy diet to lower your blood sugar and lower your trans fats as well. And look for ways to reduce inflammation in the body. So I'm going to say that again, to reduce autoimmune responses. Okay. These are those that cause hair loss. You may have to lower your exposure to pollutants, eat healthy diets that are low in sugar and low in trans fats. Okay. And look for ways to reduce inflammation in the body. Okay. So that's what I wanted you to know about diabetes and the effect that it could have on the body. Okay. So that was a lot. I just want to make sure that you understand it. But I want to go into another part of this when we're talking about types of conditions, because this is something that I think happens. And I don't know if we are aware of this one as well and how all of these things connect. So oftentimes, you may have heard of, or maybe you haven't, but I'm going to mention this to you today, something called polycystic ovary syndrome. Um, and the acronym is PCOS. So let me tell you about that. Some people that experience polycystic ovary syndrome, which is PCOS, they experience a different type of hair loss called androgenetic alopecia. Okay, it's a type of hair loss. Okay, and so it's in females, um, and the pattern that it takes on is different from the pattern that um, men experience when they start to experience alopecia. Okay, it causes a receding hairline, and it also can cause thinning in the crown. So, what you may see or notice when a woman is dealing with polycystic ovary syndrome or PCOS, you may see thinning in the top of their head and a widening in the middle, right? So, in the crown of their head, you will start to see the hair would be thinning, and you also see um, widening in the middle. Like it looks like maybe sometimes if it's apart, or you'll see that area that is thinning, not thinning, but thinning, you will see it widen as well. So some people that deal with PCOS, they develop multiple cysts or fluid filled sacs in their ovaries. And these cysts form if an egg cell does not mature or release from the ovary during ovulation. And so the cysts produce excess androgen. Okay. And it is an endocrine disorder. Okay. And so what we want to know is that polycystic ovary syndrome is one of the most common endocrine disorders affecting women of reproductive age. And it involves pathways that produce metabolic, reproductive, and cardiovascular or derma, I think it's dermatologic effects. Okay. So when we're talking about this, it's important that we know this because sometimes I think this type of hair loss can look very similar to androgenetic hair loss, which is when a woman age, her hair would start to thin, but it's not the same. So let's say you are experiencing thinning in the top of your head, and you are not at the age that hair would normally thin, but you are having some issues with PCOS. You may want to make sure that you see someone about it, because if your doctor starts to work with you sooner to take care of these things, the hair will probably grow back. Okay, so androgenetic alopecia, also known as um, genetic, androgenetic androgenic alopecia. So let me go back. Let's start over. Androgenic alopecia, also known as androgenetic alopecia, is the pattern of hair loss that affects males and females. But in people that have PCOS, the pattern is usually different from what is seen in male pattern hair loss. So males, they will usually have a receding hairline, and then at the top, they'll start to have that circle. So you probably have seen that. While male hair loss, while male pattern hair loss will start in the front hairline, and then gradually they may meet. With female pattern hair loss, the pattern will develop in one or two different ways. Okay, so this is what may happen. Thinning will start mid-scalp and gradually spread in a circular pattern. So it might start in the middle of the scalp, but then it'll start to go into a circular pattern, okay? Also, the thinning will start at the hairline, and it may gradually spread backward along the center of the scalp in a triangular pattern, okay? Sometimes referred to like Christmas tree. That's why I said triangular. While the thinning is wider at the front, is narrow at the back. And so depending upon if you studied in front of a person. Also, I want you to know, rather than complete baldness, so rather than this person completely becoming bald, or this female in the area, or losing their hair totally, female pattern hair loss typically causes the person's scalp or the hair on that part of the scalp to be thinner, and it will be shorter. All right. And so even so, the thinning can be significant enough to expose large areas in the scalp. So if you are standing over that person, you see the person, it may be very, very thin in the area. And then it'll look like a circle, because you'll be able to see almost like a circle where it looks like it's really thin. But then you can start to see how it's thicker on the outer parts of, okay? So in people that deal with PCOS or androgenic alopecia, um, it rarely occurs in isolation. So basically, in addition to female pattern hair loss, people with PCOS may also experience weight gain, obesity, abnormal or irregular cycles, menstrual cycles, or no menstrual cycle at all. They may have oily skin and acne. They have something called, um, well, basically what it look like, it'll be excessive hair on the face and things of that nature. They also may have some fertility problems, and they also may experience depression. And so make sure in clients that you or people that are experiencing this, make sure that you talk with your doctor and you get with them about it. Now, why is this important? Because from what I've studied, a person that doesn't deal with this particular type of condition, PCOS, this could lead possibly to um, diabetes if it's not treated. Okay, that was my understanding. And so I want to make sure that I went over that with you. And that is one thing that I want to make sure that we are aware of when we are talking about different types of hair loss and conditions that cause it, because it is very important for us to be aware of the different types of conditions that will actually cause us to lose hair. Because I've seen wherein clients have had situations that are happening with their hair, and just because they were not aware, oftentimes what will happen is they will start to go and receive salon services, and those salon services, all it does is it will cover up. It may cover up what is really happening without treating it. Okay. And so I want to make sure that people are aware of the different types of conditions that can lead to hair loss. It's very important. So, based on the studies that I've seen, more than half of women that experience polycystic ovary syndrome develop type 2 diabetes by the age of 40. And so, what they're telling you is gestational diabetes, diabetes when a person may be pregnant or expecting, which puts a pregnancy or a baby at risk and can lead to type 2 diabetes later in life for both the mother and the child. So be very mindful of that. And also heart disease. Women with PCOS are at a higher risk um, of um, heart disease, and the risk increases with their age. Okay. Now, listen, these are things that people are saying could happen. It doesn't have to happen with management of it. Okay. And so I just wanted to make sure that I mentioned to you the things that can cause hair loss in the area of diabetes, and not only diabetes, but also when we're talking about PCOS, which is polycystic ovary syndrome. Okay. All right, so let's just make sure that we are managing that if that is happening with us. And what I will also say is um, go to No Hair Shame, that is KNOWHAIRSHAME.com, and go ahead and fill out that contact form if you are experiencing this. And we can also talk about some things that you can make sure, in addition to managing your diet and the exercise and watching your trans fat and things of that nature when you're monitoring your diet. Let's just make sure that we are managing it and that we're exercising and we're doing the things that are needed. Even for those that are not experiencing diabetes, I tell people to make sure that they monitor those things, because we want to keep our bodies in the best condition possible, just so we have overall health, but not just so that we have overall healthy bodies, but also so that we can also manage the hair. Okay. And so let's just make sure that we're doing the things that are necessary that will help us. Okay. So, last but not least, when I'm talking about PCOS, the four types of PCOS is insulin resistant PCOS. Okay. And then you have adrenal PCOS, you have inflammatory PCOS, and you have post pills PCOS. And so those are some of the things that I just want you to know about PCOS, how it can lead to diabetes, and how we need to make sure that we're monitoring and we're taking care of our bodies so that we can stay in the best health as we possibly can be in for our overall health, and also how we can prevent some of the conditions that we're dealing with if we're not doing the things that we should do, how we can prevent them to leading to other areas such as hair loss in our body. Okay. Because I think what happens with the person, if they're dealing with diabetes and they're not dealing with that, then they start to see other things that happen in their bodies. And if they don't realize that the two are connected. So let's say a person is diagnosed and they have issues um, in that area, and then they're stressing based on the result of it. Then they start to lose the hair, or they notice that their hair is thinning. That causes more anxiety and more stress. And if a person is not aware that those two are connected, what you may find yourself doing is going to the salon, receiving services that only cover up or mask what is happening. The hair starts to thin, and then you start to receive services like if you do hair additions or any type of services that put stress on that hair, because not only is that hair thinning, that hair is also probably not as strong as it was before. And so then if you start to put some tension in those areas, it becomes a different type of hair loss because it's the thinning is a result of what's going on, the inflammation, the bacteria, and the fungal um, infection that is happening on the scalp. The hair is thinner, and then you go and you start to put tension in those areas, and we call it traction alopecia, which happens on the surface. So you now have hair that was in a fragile state as a result of how it was formed based on what was happening in the body. But then you go on the external surface of that and you start to put tension on hair that may have already been compromised as a result of what was happening internally, and then you have two different situations going on, and this starts to progress. Oftentimes when I see people and they're dealing with hair loss, it's not always a one fix. You have to find out what is the source of what is happening, and then we have to put some preventive measures in place. And so what I'll do is I'll talk with you about some suggestions. You're working with your physician to correct what's happened medically, and then you also need to work with a professional stylist. I can make some suggestions to see some things that you can do that will not cause further damage of the hair or the hair follicles, where you end up in a situation where it is, we call it CCCA, and it's a long name, but it's basically a result of styling, hairstyles that you're wearing that is also causing issues. Okay. And so I'm going to leave it at that for today. So let's just make sure that we do the things that we need to do when it comes to diabetes, the issues that we face with that. Also, let's make sure that we are working with our doctors and our professionals, that we're allowing them to help us to correct that. If you're dealing with PCOS, polycystic ovary syndrome, that you're aware that those things untreated can lead to diabetes and the things that they're saying that it could cause, so that we decrease those things so that we can allow our bodies to get what is needed for those essential organs. And then our non-essential organ, which is the hair and the hair follicles, they receive what they need. We can reduce the thinning, which is going to help us to reduce some anxiety and also to relieve some of the shame that comes along with losing the hair. Okay. All right. So this is Tanita with No Hair Shame. Look, I would be more than happy to work with you. Make sure that you go to nohairshame.com. Go ahead, reach out, fill out that contact form, and I'll be more than happy to do a consultation and talk with you about some other things that you can do. I do a thorough consultation, and I'll make some recommendations. Okay. So I look forward to seeing you next time when we start to talk in depth about some other conditions that people face that could be causing hair loss. Thank you.